From here at News 4, Governor Bill Lee doing his daily news conference with some important information today. Let's go ahead and listen in.
And every government across the world. Currently, our state has 1,834 confirmed COVID-19 cases, an increase of 297 cases since yesterday. COVID-19 is in 77 of our 95 counties, and we have had 13 deaths across the state. More than half of our states also currently under some form of shelter-at-home orders, especially in our population-dense cities. But I have a particular concern about this situation escalating in our rural communities. Today, I'm announcing measures that will implement safer-at-home guidelines in every county in our state to better our approach to social distancing while also protecting the livelihoods of Tennesseans. This is not a mandated shelter-in-place order, because it's deeply important to me that we remain a state that protects personal liberties. But it is a strong urging for Tennesseans to stay home when at all possible, because I also believe that with personal liberty comes personal responsibility. I have said that I have sought discernment to identify the right decision at the right time for the right place. Today, I signed Executive Order 22, which restricts businesses that cannot possibly safely operate during this COVID-19 crisis, including businesses like barbershops, salons, recreational and entertainment outfits. The order at the same time provides for the continuation of essential businesses throughout every county because of my belief that we must protect our economy while protecting the lives of Tennesseans. We've asked Tennesseans to stay at home when possible since March 22nd. Yesterday, President Trump provided new guidance from the CDC that's evolved and extended isolation measures up to April 30th. And we believe that Tennesseans in non-essential capacities should take the additional step of remaining at home from work, school, and non-essential businesses. Now, I want to speak directly to Tennesseans who have the privilege and the capacity to safely remain at home for the next 2 weeks. We need you to do that, to protect the lives of your neighbors and protect the lives of Tennesseans, to protect the well-being of our healthcare workers and our essential employees and vulnerable populations like the elderly in Tennessee. We need you to stay home where at all possible. Your habits and your routines will make the difference as we work to swiftly defeat COVID-19. We will work together to establish new habits, like safely supporting Tennessee businesses, ordering takeout or shopping online or shopping for essentials at the grocery in normal quantities and resisting the urge to panic buy. The faster we blunt the surge of this spread, the faster we all get to go back to work. The COVID-19 pandemic has caused tremendous uncertainty for Tennesseans and left many small businesses in a vulnerable position. So we're also calling on the business community to embrace alternative business models and partner with us in the fight against COVID-19. We're calling on businesses and entrepreneurs to be part of innovating in the field of healthcare management as we rapidly scale operations to care for the sick. I've directed Unified Command to engage in a partnership with Launch Tennessee to work directly with Tennessee businesses and entrepreneurs who are willing to switch production to make life-saving PPE and medical supplies. To that end, we've welcomed Margaret Dolan of Launch Tennessee to our Unified Command team as she brings years of entrepreneurial and troubleshooting experience. As businesses face tough decisions in the coming months, my administration commits to providing ample resources from the federal stimulus money that was just passed by Congress. We'll also continue to make every effort to connect displaced workers with employment opportunities. I'm very proud that Lieutenant Governor and the Speaker are here with me today, Lieutenant Governor Randy McNally, Speaker Cameron Sexton, to show their support for what we are pursuing I want to continue the work that we have done in the past, but continue to work with the legislature as we develop solutions and develop strategy to go forward in the months ahead. I would like to welcome Lieutenant Governor Randy McNally to make a few comments.
Thank you, Governor. Thank you, and thank you for all you've done. I continue to support your efforts and your work with the legislature and your work with city and county officials throughout the state as we face this crisis. But I'm also happy to have with me my partner and a great Tennessean, Speaker of the House, Cameron Sexton.
Thank you, Lieutenant Governor, and thank you, Governor. And Governor, thank you for the leadership that you provided Tennesseans during this difficult time. I know that this decision today was not easy for you, and as you've thought about it and debated it, one thing I do know is we're all taking the public health of all Tennesseans very importantly as we continue to move through this role. And as the governor said, please do your part and stay apart and continue to follow the CDC guidelines as we move forward. We want a healthy Tennessee. We also want a healthy economy, but that only happens by keeping Tennesseans healthy. So please adhere to the governor's executive order today as we continue to move forward. And Governor, thank you for your leadership during this most difficult time and these unprecedented times in our state.
Thank you. Thank you both very much. As I said, we will be working together with the legislature and members of the legislature across the state and leaders from all corners of the state. And I've heard from many leaders and coordinated with many county mayors and local officials to help develop the strategy going forward. We'll be working together. Together in this state, we can accomplish what we need to accomplish. Next, I'm going to ask Dr. Lisa Piercy, our Commissioner of Department of Health, to come forward. Dr. Piercy is going to make comments about the Gallatin nursing home situation that we face, that many of you have heard about. I wanted her to provide additional information regarding that and the situation in general. Dr. Piercy.
Thank you, Governor. By way of general update, our current case count is 1,834 cases, 148 hospitalizations, and 13 deaths spanning 77 counties. As I'm sure you're aware, this is a substantial increase and the numbers continue to grow. One of the most concerning trends we've seen is an increase in our elderly population, and specifically that at the Gallatin Center for Rehab and Healing, as the governor just mentioned. Over the weekend, we dealt with a rapidly escalating situation, and ultimately 74 residents and 33 staff members tested positive for COVID-19. While we have not yet officially confirmed hospitalizations or deaths, we have seen lay media reports of at least one death, and we know of dozens of hospitalizations related to this. As mentioned, this was a rapidly escalating situation that required a swift and aggressive response. We determined that given all of the factors, the best course of action was full evacuation and decontamination of the facility. It is our hope and plan that these residents will be able to return back to the facility who are medically appropriate to do so in the next 48 to 72 hours. I want to be clear. The Gallatin Center for Rehabilitation and Healing has been an excellent partner throughout this entire weekend. To date, although the investigation is ongoing, we have not identified any deficient practices there so far. They continue to be very cooperative and protective of their residents, and we appreciate that and want to do the same. Also over the weekend, I issued guidance on Saturday night to all long-term care facilities, expressing our deep concern about risk in their facilities. We also issued guidance on immediate notification of any cases in nursing homes, both in residents or staff, so we can act swiftly and appropriately in order to protect all involved. Thank you.
I want to just make a couple more remarks about the efforts that we are making across the state, and particularly with our Unified Command Group. We are incredibly focused on the issues surrounding medical supplies, personal protective equipment, the number of hospital beds, the number of hospitalizations, and our healthcare capacity to meet those hospitalizations. We are incredibly focused on preparing our state in the most effective and most efficient way we can to utilize our private sector providers and the resources that we have at the state, along with the National Guard, to provide services all across the state. We will get through this. We will find our way uniquely through it as Tennessee, and I'm very encouraged by the cooperation of folks all over the state to make it happen. We will open up this opportunity to answer questions, and then I'll close with some closing comments after we have questions. So let's have questions.
First, we'll go to Kim Crucy with the AP. Kim, your mic is unmuted.
Hi, Governor. My question is that for several weeks now, you have encouraged Tennesseans to stay home. You have resisted issuing a mandated shelter in place, as you repeated today. I guess my question is, what makes you think Tennesseans are listening to you to stay home? We had a beautiful weekend this past weekend where there was a lot of people out and about. What makes you think that this announcement will be different?
Well, this announcement actually substantively changes the activities with which people all across this state can participate. This is similar to the directives many states across the country. So we're closing non-essential businesses in every county in this state. We are maintaining the operation of essential businesses, which is incredibly important to maintain the economy, but we are closing down those businesses that can't safely operate and encouraging Tennesseans who either are not working at one of these essential businesses to have no reason. We're encouraging them to have no reason to travel because of the closure of those businesses. So it's a substantive change in our direction.
All right, next we'll go to Joel Ebert with the Tennessean. Joel, your line is open.
Yeah, Governor, this is a question about transparency. Obviously, you need to delegate or have the balance of not having identifying information about a number of things, including deaths and fatalities. But we've seen several other states release said information and not compromise people's information. We've seen, including local counties, do that. So will your administration look at changing that policy to release county-level death data, as well as, knowing information on the county level of the number of beds, ventilators, hospitalization?
Yeah, Joel, thank you, because I do think our administration wants to be totally committed. We want to be committed to transparency. We want people to understand. It's the reason we're doing a press conference and ask questions virtually every day of the week, because we want information to get out there. There's a unique and challenging legal issue around reporting deaths by county, but we want to get past that issue if at all possible. So we are exploring that very particular issue, because we think that we may be able to work through those legal challenges, but we will give you an update on that situation. We are committed to transparency. The more information that we can provide, and I think you've seen that as there have been requests for additional information around, I think in your case, the number of ventilators and how that was, what the context around ventilators numbers were, and then we turned around and tried to get you that information. We do want folks to know that we're that we're committed to transparency, and whenever there is a unique situation that doesn't provide the information that we think folks really want to hear and need and is important and protects the citizens at the same time, we're going to do that. But the particular issue you talked about, deaths by county, we're looking into, and we'll have further information for you on that shortly.
Real quick follow-up, though, on the beds and ventilators. You gave us sort of a number that is at that given time. Why not have an everyday, minute-by-minute update so people can know, is their facility in their county over capacity?
Yeah, well, those numbers do change all the time. I'm going to let Dr. Piercy specifically address that, but I also will say that what we're doing every day now is looking to our healthcare providers and asking them for more and more information. The fields of information on our dashboards that we're providing, we're increasing those fields. So, Dr. Pierce, you want to specifically talk about beds per county and information and the transparency around such?
Sure. Thanks for your question, Joel. The answer is it's a bit complicated. We are watching it on a day-by-day basis, but there is a significant difference between licensed beds and staff beds and surge beds and all of the different levers that health systems can pull to increase capacity when situations happen like this. So whereas there's really nothing particularly secret about the bed capacity number, I mean, that's publicly reportable data as far as what each hospital's licensed bed capacity is. But as the governor referenced, those numbers change daily, and so they don't always accurately reflect what the day-to-day situation is. We've been watching them as a percentage, and the inpatient bed capacity and the ICU bed capacity has been north of 30%, and that's even more than it is in a typical flu season right now. So, and ventilators is upwards of 70% available. So we're in a good shape right now, and we continue to watch that daily.
I will say at the same time, while we, for example, have bed capacity, we are pursuing alternative strategies to increase bed capacity. We'll be talking about those later when we have more definition about what those strategies might look like and where they might be located, but we are currently pursuing rapid expansion of temporary hospital-type facilities in our community and in multiple communities across the state. But that's not complete yet, but we're working in that direction to make sure that even though we're reporting the number of beds, we're trying to develop additional beds.
Next, we'll go to Nancy Amons with WSMV. Nancy, your line is open.
Thank you for taking my call. How do you think that Tennessee compares with other states our size as far as the number of cases and the severity of those cases?
It's a good question, and it's hard to compare states to state, but I'll tell you what I do know. The reason it's hard to compare is because some states are testing substantially more than others, and so while their numbers might be substantially higher per capita, if you're not testing at a high per capita rate, then you don't really know what your population is. I will say this, Tennessee is testing per capita at a much higher rate than the majority of states. So we're in that obviously changes daily, but we've done, I think, 21,000 tests in our state. Our rate of testing per capita is very good, which means that the data that we have is probably more reliable than the data that other states have. Based on that testing capacity, our infection rate is about in the middle of those 50 states. So, and our population is higher than in the middle of the 50 states. There's a lot of data around that, but I'll just say this. Very difficult to compare states, but what we can compare, we feel encouraged, and the things that we can control, which is testing, we are aggressively pursuing testing. I'm a strong believer that the more aggressively you test, the more you know, that's for certain. And the more you know, the more you can make targeted responses that are appropriate. That's why we are testing at a higher rate than most states, because we have a strong commitment to expanding our testing. By the way, we've now opened up 33 remote testing facilities across rural counties in Tennessee, utilizing the National Guard, besides the other drive-through and remote assessment facilities that we had in place. We're pursuing new avenues of testing and assessment, so we're encouraged.
Thank you.
Next, we'll go to Sergio Martinez Beltran with National Public Radio. Sergio, your line is open.
Yes, good afternoon, Governor. Thanks for answering our questions today. So we have learned that the Department of Human Services will not inspect or regulate the emergency daycare facilities. How do you ensure the safety of the kids in these centers?
Yeah, you know, I wish that our director were here around that subject. But here's the thing. So we have temporarily suspended some regulations around childcare because of the tremendous challenge we have in this state. We're in a crisis, and we're in a crisis. We have to triage circumstances that profoundly negatively impact Tennesseans. When we closed schools across this state, we sent hundreds of thousands of children home to families oftentimes who are a single working parent or two-parent families. We presented them with incredible dilemmas regarding the child care of their children, the care of their children. So what we have done is loosened restrictions around child care facilities. We have allowed providers to register with the Department of Human Services so that we can provide additional support. We have given guidance to those child care providers. We've given guidance to them that they socially distance children appropriately. And let me just say this: those providers who do register with the Department of Human Services, there is a process in place for them to have background checks to help provide for the safety of those children. That's a very important step for us, that providers, we know who actually is keeping our children and what their backgrounds are. But some of those restrictions have been lifted for a temporary period of time to address the crisis. And I will actually, Sergio, get our commissioner to give an update on the safety procedures put in place to ensure the safety of our children. I'll report on that tomorrow.
But to follow up, Governor, the Department of Human Services told WPLN that they will not be inspecting or regulating these temporary facilities. Do you think they should start inspecting them? I mean, you believe in a balance, and you can still have them open, but also having them inspect.
Yeah, I suspect that the answer to that is that they're not going to be temporarily lifting that restriction to inspect. We will have hundreds of facilities opened up in a very short period of time to take care of the needs for child care across our state, and the capacity to test those is impossible for a temporary period of time. So what we have is a temporary situation that we are addressing with the solutions that we think best address the crisis. And we clearly will be following up with a longer-term strategy on how to inspect and provide additional security measures. We are providing security for children, but additional security measures. We have a crisis. We have situations that are laid before us that for a short period of time require very difficult decisions, and decisions that will address and change the way that we typically do things. But we will make those decisions in the best interest of Tennesseans, and we'll make the changes appropriately to protect our kids. We will do that going forward.
Next, we'll go to Andy Scheer with the Times Free Press. Andy, your line is open.
All right. Hi, Governor.
Andy.
Appreciate you doing this. I was hoping you could respond to this complaint that was made by the disability folks in Tennessee, which basically they're saying that your policies under a 2016 policy could allow discrimination against disabled people receiving COVID-19 care, and I think HHS's Civil Rights Division has issued something on that. What do you know about that whole order and this whole issue, and what do you plan on doing?
Well, I don't know specifically
These people are concerned about losing care.
Yeah, I'm not sure.
that they may not be placed on. I'm sorry, go ahead.
Can you give me some more specific information? I mean, here's the thing.
Yeah.
Again, I would say this, to the degree that we are wholeheartedly committed to serving special populations in this state, and the incredible challenges that have suddenly arisen with those special populations, whether it's individuals with developmentally and intellectual disabilities, whether it is the homeless, whether it is those with mental illness. Our departments across this state have had a tremendous surge in the challenges associated with this crisis. We have a crisis on our hands, and it presents unique challenges to every department. I'll just tell you this state has been incredibly committed to serving the health care, and the well-being of those with developmental and intellectual disabilities, and we will continue to do that. And wherever this crisis has created a challenge from the health and human services side, we will address that. Dr. Piercy, do you have any particular additional information there? I appreciate your question, Andy, and I certainly will get more detailed information about the issue you're bringing forth, but Tennesseans need to know, every Tennessean needs to know, regardless of what circumstance you find yourself in, the challenges that we face as a state to provide an unchanging level of service to every Tennessean, those are huge and tremendously difficult challenges, but we're committed to meeting them. We may have to make adjustments. We may have to make temporary changes in the way we do that, but we are unwavering in our commitment to provide the services that the state of Tennessee provides to every sector of our population, and we will be doing so. And when we find that there is, because of this crisis and some issue that has changed that, then we will we will work to address it. But I will give you a specific answer on that one as well, Andy.
All right, thank you.
Next, we'll go to Jordan Ferguson with News Channel 9 in Chattanooga. Jordan, your line is open.
Hey, Governor. Last week you talked about there are 537 unused ventilators currently. Can you tell us the current staff ventilators and if there are any shortages throughout the state, and how many hospitals have ventilators available?
I'm going to let Dr. Piercy answer that. She has data on ventilators. Thank you.
Related to ventilators, I didn't look at the exact raw number of ventilators that we have available. Just looked at the percentage. The last percentage I saw is that 67% of all traditional ventilators across the state are currently available. So we're only using about a third of our traditional ventilators. We also have 2 more pools of ventilators that we can use once that 67% capacity or additional capacity is depleted. One of those, the governor has mentioned and I've mentioned in the last few weeks, are the 500 plus ventilators, new ventilators that we have ordered. We have already received about 150 of those and expect to receive the rest of those in the next week or two. And so you've got the ones that are in hospitals now, you've got the new ones on order, and then there's a whole different set of ventilators that we haven't even counted yet. We're in the process of adding a field in that hospital resource tracking system that you've heard me speak of, that we're calling alternative ventilators. These are ventilators that are used in surgery centers and even in anesthesia machines that can be converted to ventilators if we need that. So we're collecting the information on those, and when you put all of those together, we feel pretty comfortable about our ventilator situation.
Next question.
Yeah. Next, we'll go to Nathan Baker with the Johnson City Press. Nathan, your line is open.
Yes, thank you. Governor, you said you had particular concern about the situation in rural communities. Can you talk a little bit more about that concern and why it's particularly concerning to you?
Well, I think that I've been watching the numbers of counties impacted in our state, and in the last several days, the speed with which this virus is moving into rural communities is concerning. So we now have 77 counties in our state that have had a confirmed, at least one, and many of them with more confirmed cases. That number's jumped dramatically in the past week. And so the fact that this virus is moving into our rural communities is in fact very discerning to me. It is disconcerting to me. It's a problem. It means that it's going to begin to affect these communities. I'm very concerned about the economies of these communities, and the faster we can get this surge done, the quicker these economies can begin to turn. Rural communities are more hard hit than others. Oftentimes, when we have downturns in the economy, like we've got dramatically happening right now. So I do have some concerns. I think that part of what drives decisions for me is data. I'm a person who I want to get facts to the degree that we can gain facts, and I want to watch data. And as those data points change, then our decisions change about what the course of action should be. So we have a course of action to a point, and then a change of information appropriately changes a course of action. That's what's happening today. The change in the number of counties, the change in the number of hospital beds, the concerns about the economies of our rural counties have caused me to take this step that I believe will actually get us closer to the end of the surge, so that we can begin to go back to work in rural Tennessee and in urban Tennessee.
Next, we'll go to Stephen Elliott from the Nashville Post. Stephen, your line is open.
Thank you, Governor. I'm still a little bit confused about the nature of what you're announcing today, because at the top you said this was a strong urging to people, and it's deeply important that we protect personal liberties. So are you saying that the instruction to citizens is still an encouragement and urging, whereas this new order mandates the closure of certain additional businesses? That's right.
This is not a mandate for people to shelter in place. This is an urging to citizens to not utilize non-essential businesses, and the reason that it is urging them to stay in place and will change behavior to not utilize non-essential businesses is by closing those businesses. It's a two-step, it's a two-component executive order. I think it sends a strong message to Tennesseans. It certainly changes the environment for which they will operate in every county in our state, and it will strengthen the social distancing policy across our state, which we all know will help slow the spread. It's real. I've said all along, we've got to mitigate the spread of this disease and protect our economies, and I think this executive order will do just that.
Thank you.
That concludes the question and answer portion. At this time, Governor, if you'd like to make a closing statement.
Yeah, I want to thank Tennesseans for what they're doing. I want to urge Tennesseans to do more. I want to remind Tennesseans that things change daily and that decisions change daily. That's important that we all understand that, but it's most important that we all take personal responsibility for this virus as it moves through our state, and as it challenges us from a health standpoint like we have not been challenged in generations, and it's challenging us economically like we have not been challenged in recent history. But together we will get through this. I have a great deal of hope. I've said in days past that there is a storm over our state. There is a storm that began the day the tornadoes hit, and it has continued through this day. And those storm clouds are intense, and they are severe, and we are weathering that storm, and we will make additional adjustments to weather that storm as we see the challenges changing. But Tennesseans, remember, the storm is passing. It is passing. We don't know where we are exactly in the line of this storm that's going over our state, but it is passing. And we will see the end of this. And if we do this right, and if we work together, and if we encourage one another, and if we're innovative and creative, and we take personal responsibility, and we seek to help those who are most vulnerable, we will get through this storm that's passing, and we will have an outcome that we are all proud of. I encourage all to be a part, to do your part, and stay apart. Thank you.
You've been listening to the Daily Briefing here with Governor Bill Lee and other officials across Tennessee. Just to give you a quick recap, I will keep this brief and return you to regular programming here shortly. So Governor Bill Lee issuing a safer at-home order statewide. Now, this has been already happening in Nashville for days under Nashville Mayor John Cooper. So now the rest of the state will join in this initiative. So here's what it means. Non-essential business closed to the public. Any businesses that can't safely operate and abide by the social distancing laws also closed. Gatherings of no more than 10 people. Keep your 6 feet away from each other. You should only conduct essential activity, which includes anything essential to your health or safety. Grocery stores, you know the drill at this point, right? You can get groceries, other supplies. You can get delivery or pickup, takeout from restaurants through the drive-thrus. You can jog outside, bike, play golf, hike, as long as you're keeping your appropriate social distance. So this is not a mandated shelter-in-place order. It is what Governor Bill Lee called today a strong urging. Stay with News 4 for continuing updates here. When we're not on air, you can always find us online.